My name is Rayanne Venturella. I'm a social worker and a master level social work candidate currently completing my master's program. Now, is this assignment going to be graded for my program? Yes. Yes, it is. But do I fully support everything that we're going to be discussing today? Absolutely. Now, social workers play vital roles on many interdisciplinary teams. Of heightened interest to myself are forensic social workers. Why forensic social workers, you ask? Well, forensic social workers work within the criminal justice setting. Now, this is a wide setting. There's a lot of different sectors within criminal justice. I'm specifically going to focus on the prison systems. Now, social workers are more commonly seen inside the lower security sectors like criminal or county jails and diversion centers, but we do see an increase of social work presence within these higher level security settings like prisons. Now, keep in mind, most inmate populations are diverse within this respective setting. That being said, they are incarcerated after having been charged with some sort of crime, but still diverse in their offenses, their housing, and their experiences in incarceration. Expanding on that, inmates are also diverse in culture, age, race, ethnicity, sexual orientation, abilities, disabilities, and so on. This is a good place to point out social workers' unique skill set, including cultural competency. Meeting people where they're at, respecting and being understanding of cultural needs and the influences in a person's life, and so on. This is extremely important as culture impacts the way that we think, behave, and perceive the world as we know it. What treatment or help is effective if not communicated within the terms of one's norms and understandings? What clinician is effective if not unbiased and free of any judgment or inequality towards those that they serve? And quite honestly, how effective can one be if not understanding of the biases and inequalities that exist and affect the clients we serve outside of our offices? That is cultural competency. And though this is a huge topic that I'd love to delve into, let's just stick to the discussion of focus here. So why forensic social workers again? Forensic social workers believe that the law, being fair and just, should serve as a therapeutic agent. Taking from what I just discussed, I feel it's important that these values make their way into this setting where a marginalized and oppressed population already resides. In any setting, social workers work on interdisciplinary teams to provide collaborative care. In this setting in particular, using the R&R model, the risks, needs, responsivity model, social workers assist correctional officers in bridging emotional, behavioral, and psychosocial concerns for individuals who have committed crimes. The principles of this model are based on the premise that treatment intervention should be applied according to reoffense risks and in a fashion that considers individual needs and characteristics of each inmate. An offender-centered posture, if you will. Overall, social workers want incarcerated individuals to grow and rehabilitate. They want to reduce recidivism and help these individuals to find a more pro-social ways to engage in behavior. So studies suggest that punitive measures are less effective in modifying behaviors than that of what the social workers suggest, which would be combating deficits in areas of self-regulation with behavioral modification to avoid those challenges in the future. Layman's terms, if we focus on the individual and their environment as a whole, provide services and/or resources where they're needed, and work on true behavior modification through compassionate care, we'll see changed behavior. But if we lock someone in a cage for a duration of time, and we offer them no new tools or skills when we release them from that cage, do we expect them to magically change the unsought behaviors? This is something at a more macro level that social workers are looking to change as well. Social workers provide those direct clinical services, like I spoke about before, oftentimes including trauma-informed care, trauma-focused, cognitive behavioral therapy, and motivational interviewing, amongst other therapeutic techniques and modalities. They also utilize their strength-based approach to meet individuals where they are at, pull on those individual strengths to emit boosts of confidence and success in a setting where dehumanization almost is the forefront. Though challenging as it may seem, social workers are equipped to handle the task. Social workers also run groups for counseling around addictions and other areas of identified needs. They find resources and connect individuals to these resources, most often after they're released from incarceration, like housing, job training, financial supports, and so on. The anticipated outcomes of social workers on these integrated teams is, of course, a reduction in recidivism and positive impacts on incarcerated individuals, to include behavioral modification and societal economic help outside of the prison walls where they may have been struggling prior to coming in. But at a more macro perspective, social workers' presence here could impact the system and their beliefs behind this punitive type of incarceration, as well as the stigmas around inmates when they are released and reintegrated into society. And you see these changes that have come, like giving felonies the right to vote again, and other changes that we've made since then. This is what we're looking at a more macro level to change as social workers. Now, there are multiple policies that surround and affect the prison systems, but narrowing this down to the state of Florida, where I both reside and work, I wanted to bring attention to a particular statute surrounding mental health in the corrections. So under Corrections and Mental Health Act, pursuant to Florida Statute Chapter 945.49, orientation and training, correctional officers employed by a mental health treatment facility shall receive specialized training above and beyond that required for basic certification pursuant to Chapter 943. My thoughts behind this? I don't believe that all inmates suffering from mental health conditions are secluded to mental health treatment facilities. I think that there's a large population of them within prison settings. So do I believe that all correctional officers should be trained with this mental health specialized training that goes above and beyond that required for basic certification? Absolutely, I do. Do I believe that if correctional officers were trained in this specialized mental health training, we would see a reduction in recidivism with or without social work presence? I do. Do I believe there would be a decrease in suicide within the prison setting? I do. And do I also believe that there would be an overall reduction of mental health crises, both in and when first released from prison settings? I absolutely do. So thank you for listening to me. I hope that you learned a little something out of this about interdisciplinary teams, the social workers' roles within these teams, and the prison setting, and how social workers are looking to impact this system. Thank you.